Great. So hi, everyone. First of all, it's a great pleasure to be on the panel with everybody here. I know most of these people, and they're really outstanding people. I feel really privileged to share some time, and thank you, Nick, for inviting me. I want to talk about a StudentLife COVID study that's going on at Dartmouth, and typical with talks that I give in 9 minutes. I'm very stressed. I have got a lot of slides. I'm going to sort of skip over a lot of the details just to give you a sense for the data, and so we can have a discussion. Okay. So if you looked at the New York Times COVID data today, you would see a sort of time series like this going back to the beginning of the pandemic. The good news is that cases are down, new cases are down, deaths are down, hospitalization is down. That's all good. One factoid that I read this morning was there are 3 states where the 7-day moving average is going up. 3 states in the country. One is Vermont, where I live. The other is New Hampshire, where I work, and the other one is Colorado. I have no relationship with Colorado, but we're interested in actually looking at how has the pandemic changed the behaviors on college campuses and with college students. And of course, you know, there's been a lot of information in the press, what's happening with all different demographics, including students, but wanted to see, you know, under the hood, what sort of data could we gather that could tell us about, give us some insights into behavioral change, or perhaps the sort of rise of certain groups within a sort of cohort. So we were fortunate that we're doing a study at Dartmouth, an NIH study at Dartmouth, looking at mental health of students. And it's a longitudinal study. We're following 200 students across their 4 years at Dartmouth College. And part of the cohort's already graduated, actually. So we started actually in 2017, and right in the middle of, well, not right in the middle, but in the middle of the actual study, on March 13th was the national emergency, where the president declared that COVID was a national emergency, shortly after WHO declared it as a global pandemic. So we're using mobile phone data and self-reports. Most of the self-reports are a weekly self-report, 1 weekly self-report on the PHQ-4. There's a self-esteem assessment and a stress sort of like a scale, as well as later on we added a sort of COVID concerns self-report as well. And we're collecting a whole bunch of continuous sensing data, as Nick talked about in his early presentation there. Interesting enough, we're also collecting periodic brain imaging from these students as well, but I won't talk about that because I'm not a neuroscientist. So because we have this data, we can actually look at a baseline year prior to March 13 and a COVID year after March 13, and we can do a comparison, apples to apples comparison, to look at behavioral changes or, you know, groups, or try to do predictive analysis from the sensing data. So I just want to show you some data. This is not statistically significant data, just to give you a feel for things. I'm just going to show a bunch of time series across the 4 years for some of the sort of behaviors from the phone. And this is phone usage. And you can see it sort of increases right up until just before the declaration of the pandemic. So a lot of publicity early January and February, right? And in March, we had the declaration. You can see a significant increase in phone usage, which has remained pretty high since then. The dots on the top here are actually the terms, and the black dot is the beginning of a new term, that's the fall term, and then the green there is the start of a break, that's the winter break, and then that's the winter term, the spring term, then that's the summer break, etc. But I'll probably not go into those details of, you know, what the cadence of the different terms. This is socialized, so this is all from continuous sensing data. This is not self-reported. This is all socialization and partying of students. So you can see a sort of increase in partying. This is actually sophomore summer, where the students are on campus, because it's the summertime when we typically don't see any partying. Of course, students are not here. You can see that students are actually back on campus now, and they're sort of, you know, re-engaging in their sort of social life. Studying behaviors has changed significantly. We haven't looked into this. This is not published data yet. We haven't really dug into this, but you can see studying trends have really changed significantly. Importantly, unique locations visited, which has its relationship to mental health, of course, has significantly changed and hasn't sort of rebounded. And we could hypothesize about that. And finally, this is actually a self-report from students. This is their anxiety. This is the GAD2 and the PHQ-4. And you can see the ebb and flow in the terms of students rising sort of anxiety, and then when they go home, sort of dropping off throughout the years prior to the pandemic. And one interesting thing is, like, before they actually come back to campus, their anxiety levels begin to rise every single time, which is an interesting trend. And then their anxiety levels stay high, and then you see this dip. And I believe that's probably associated with this curve here, where we came through the summer, felt good, and then now we're back into Delta, and this goes up to just August. So one of the things we wanted to look at with this data was to look at were there any significant differences in the data in the baseline year to the COVID year. And so we used the Wilcoxon's signed rank test to actually determine if there were statistically significant differences. And of course there are. It's shown here on this slide, where on the y-axis we're showing the change features, that's statistically significant change. And on the x-axis we're showing the percentage change, where the red lines are decreasing behaviors and the green lines are increasing behaviors. And so we can see, and it's been published before, that there's a significant decrease in physical activity of students and places visited. But also interesting things like there is a reduction in the number of times they unlock phones, but that has to be coupled with an increased screen time. So the behavior in using phones has changed. It's not this walking around campus quickly, turning on the phone, turning it off, 200 times a day. They're turning their phones on more and saying online more, and then turning their phones off. So there's a number of interesting sort of behavioral change statistics that's significant between those two epochs shown here. Another thing that we looked at was, were there any significant groups in the cohort? And so we used basically PCA for dimensionality reduction of the data. We used the k-means and silhouette, used the silhouette coefficient to determine the optimal number of clusters. And what I'm showing here actually is the self-reported data from students, which included this COVID questionnaire each week, which is how concerned are you about COVID. We show the distribution of Likert scale from 1 to 7 here, which is not worried, extremely worried. And there are actually, so we determined the significant changes in the data in the different clusters using Kruskal-Wallis H test. And I can just briefly say here that there is a difference between these groups. Of course, this C2 group here is sort of more depressed, more anxious, more stressed, has lower self-esteem and higher COVID concern. So this, this would C2 would be, and these, by the way, these two clusters, C1, 2 are sort of balanced the number of people that are in them, but this would be an intervention group if you had such a system, right? Looking across the whole COVID time, right up until, pretty much last month, September, you can see that, there is a, step function into COVID concerns, it remains pretty high until we come into the summer. And then it's starting to peak again. This is just, not scientific, but I think this is prior to the summer, prior to the Delta emerging. We also did the same analysis on looking purely at sensing data, and we also found statistically significant data between two different clusters. And here, this is interesting. Again, we'll show the sort of H statistic here. This is interesting. The C1 group is the C1 group has less screen time, goes to bed earlier, unlocks their phone less, gets up later, sleeps longer, is engaged in more sort of social media, and is more stationary at home and during the day. One other analysis we run and show here is sort of a correlation matrix of Spearman correlation coefficients to look at the relationship between COVID concern of a student and their mental well-being. And all we can really say here is that COVID concern is moderately correlated with depression and weakly correlated with anxiety and stress. And my final point is where we are right now with this data set is we're still sort of mining the data set, but we're also looking at some predictive analysis. And here we just some initial work on classification of the medium split between high and low COVID concerns, and you're sort of using a variety of like convolutional neural networks. We've been able to get sort of reasonable performance. We also ran sort of like permutation analysis on the data to try to because deep models are typically not interpretable. So what are the significant features in this model? And again, we found that the significant features are associated with unique locations visited, time spent at home, whether it's physically at home, the students are at home with their family, or on campus in their dorm, some physical activity, sleep durations, the number of entertainment places they visited, and some phone usage features. So thank you very much. Hopefully I was under my 9 minutes. This is a picture from the first in-person class that I taught in the summer, where I taught students Python programming. It was great to be in front of them again, even though we were wearing masks. So thank you. I'll stop sharing, Nick, and pass the control back to you.